Hi, everybody. It's Brenda, and this is OTD 550 Research Methodology. This week, we're looking at what are levels of evidence and how do I determine them. So, we're going to be using the Johns Hopkins Nursing Evidence-Based Practice Guide to use our evidence leveling. There are actually many taxonomies. Our textbook has one from Cochrane and one from, I think it's Oxford. But there are also many others besides just those. But I really like the Johns Hopkins because it's very methodological. It takes you through all the steps and it gives you flow charts and all kinds of great tools for helping to critique the evidence that you're looking at. So that's what we're going to be using today. So hopefully by the end of this week, you're going to be able to critique a research study using that Johns Hopkins leveling tool. So we have some announcements. The one I wanted to highlight there in yellow is one that says you actually do have a CAT template example, because this is what we're working towards. We're going to be critiquing the evidence for ourselves, and you're going to be critiquing the articles that your research group is collecting. But I provided an example for you because it is a rather complex skill to develop. And so I want you to have what I want it to look like. So use that CAT example that's on the week 7 lesson in Brightspace to give you kind of a guide as to what it looks like, the level of depth that I'm looking for in regard to those assignments. So why do we need to critique the evidence? Some of this is stuff we've already talked about, right? Because we know that not all evidence is good. Not all of the literature that we get is standalone. And in fact, much of the literature that we develop in occupational therapy is done with smaller samples. It's done with quasi-experimental studies. So we need to be looking at the evidence as a whole, not just at individual studies. And we need to be looking at and really critiquing and thinking in depth about whether or not the literature that we're looking at provides evidence for something that we should be implementing in practice. This will also tell us about the quality of the piece of evidence that we're looking at. It'll help us to identify what is current best practice and what is really not a best practice that we're just reading about, hey, I tried this and you can too, and maybe it's not something that we should be implementing in practice. It also helps us look at the bulk of evidence, not just one study, but multiple studies, so that we can figure out how we translate this knowledge into practice. What are the recommendations that we can carry over to practice? So it's more than just leveling. Of course, we're talking about a methodology with the Johns Hopkins that helps us to provide a level to a particular study and also a quality level. But it's also more than that. It's also looking at what are the different aspects of published research. What does the publication process look like? What kind of rigor has this evidence had to go through to get to this particular step? What's the quality of the journal where this article is published? Is it something that I feel like I can trust? Also, if we hearken back to our general knowledge of statistics or where this information has come from, it can help us think about what's the quality of this particular piece of evidence that we're looking at. We can use all that information about validity that we've developed and learned up to this point in time to be able to help us understand the quality that we're looking at. And then that translation piece. Okay, so this is a great piece of evidence, but is it useful in practice? How can we translate this into practice? So the Johns Hopkins model was actually made just for this. And I know we're going to kind of hang out with just one piece of it. We're going to hang out with the parts that help us to provide a level of our evidence. But I wanted you to get the sort of global picture of what the Johns Hopkins tool does for us. It has a number of appendices, which I provided for you, and I'd recommend that you keep them as reference materials for your future research endeavors with your research group. But Appendix A helps us look at what is the process, what is sort of the overall view, and how do we set up project management as we're going through this process. So in other words, this evidence-based practice process is not for your entire research project. It's for the literature review portion of it. And it's for doing evidence-based practice projects when you're in practice, because this is the sort of thing that you really will be and should be doing in practice, is at least gathering the evidence. You may not be creating new evidence, but you're going to gather the evidence that exists, critique it, and figure out how to put it into practice. That's what this tool is for. So this PET process looks at practice, what's going on in your practice, which develops a question. Then you look at the evidence behind what might answer that question, and then you're going to translate that evidence into practice. And that's what the Gantt chart or a project management chart would be for, is for taking you through that process. And it even starts with asking the question, do we even need an evidence-based practice project at this point in time? Is that what we need, or do we need something else to help us answer the questions that we're having in practice? So Appendix B is something that you've already done with your literature reviews, and that's create they call it a PICO question. They don't include the T or the aspect of time, or they call it a PICO question, depending on where you're from and how you pronounce that. So this PICO question is the problem, or the patient or the population, the intervention as compared to what, and what is the outcome that we're looking for. So creating that question, there's an appendix for that. They actually give you a tool for that. We used a different tool earlier in this semester, but Johns Hopkins has one as well for that. Appendix C would be for when you're in a clinical practice setting and you need to think about, well, who is this evidence important to? Is it just the clinicians and the patients, or are there other people who would care? Are there physicians that would want to know? Are there family members that would want to know? Who else is it that we're going to be communicating with? Maybe it's the rest of the interprofessional team. Maybe it's communicating to other occupational therapists in a conference type setting. So we need to be thinking about, who else are we doing this project for, just besides our own little work group? Or is it just for our work group? So this is sort of an internal dissemination plan. How are we going to use this information in our practice setting? All right, I know concept maps and schematics like this may be a little overwhelming, but this is sort of the overall airplane view of what goes on, or the 50,000-foot view in the Johns Hopkins evidence-based practice project. I won't go through each step of this, but basically it's the inquiries. We come up with a question. We look at how we would be using that in practice. We reflect on that. We look at our learning. Then we're looking at the evidence in practice, which is what we've been doing this semester with our evidence searching. From that, we gather what we know about what our best practice is. What do we want to implement for our own practice improvement? Reflect on how that's going, which might create another inquiry question, and begin the cycle all over again. So this is the evidence pyramid. This is sort of similar to the pyramid that's in our textbook. This is from the Johns Hopkins Tools, which is written by Dang et al. That's what the reference is there. And it takes you through all these different levels of the pyramid. On the top of the pyramid, our level ones would include systematic reviews of randomized controlled trials, whether or not they have a meta-analysis with them. A meta-analysis would be a statistical analysis of what's in that systematic review. Also on the top of the evidence pyramid are single study randomized controlled trials, or it could be a mixed methods explanatory study with the main emphasis of the mixed method study being the randomized controlled trial piece. Our level twos are going to be our quasi-experimental studies or explanatory mixed method studies with quasi-experimental methodology as the main component, and also systematic reviews that include quasi-experimental studies or quasi and experimental studies in them. Our level threes are going to be our non-experimental studies or our mixed method studies with non-experimental as sort of the main component. Systematic reviews that include non-experimentals, but also may include quasi or experimental studies. So basically, if you're including non-experimental studies in your systematic review, it's going to take it down to a level 3. Which again, remember, don't think of these as being like value judgments, okay? They're just letting us know where on this evidence pyramid the particular piece of literature that we're looking at is. And then mixing that with that validity information that we've been looking at in the past few weeks, we can think about, okay, what can this study actually tell us, or what can this group of studies actually tell us about what we can implement in practice? For example, one of the things we know about non-experimental studies is that they can only tell us correlational information. They cannot tell us causational information like a randomized controlled trial might be able to. So we have to think about how can we take this information based on the level of evidence that it's at. Okay, so other types of level threes would be mixed method studies that use exploratory, or maybe they sort of lead with that qualitative information and then add the quantitative later, or maybe they balance the quantitative versus the qualitative in their mixed methods study, or a qualitative study or a systematic review that includes qualitative studies would automatically put it at a level 3. Well, what's in level 4? Level 4 includes authority opinions. So these are expert opinions that have been written up based on evidence, but they're not the evidence itself. It's almost sort of a secondary source. So clinical practice guidelines are another secondary source. So the American OT Association has a lot of clinical practice guidelines using the evidence to tell us what things are in those studies that we should be putting into practice. Basically, have already translated the information for us. And they're great for that purpose. We just need to recognize that when we're looking at them, we're not looking at the evidence itself. We're looking at a compilation of the evidence that exists. This can also include consensus papers, other practice guidelines papers, maybe that aren't clinical practice, but that are, practice guidelines that are more like out in the public. Okay, and then our level 5s include non-research or more experiential based that are just more descriptive. So think of this as like an OT practice article that's not peer reviewed, that is simply telling you about, maybe a case. Maybe it's not a particular individual person, but it's a case occurrence of like a group that was conducted. Like an intervention that was done with 6 people and it went really well and they wanted to tell us about it and maybe consider future research options regarding that. That might be experiential based or non-research based. Okay. Scoping reviews, which are literature reviews that do not have as rigorous of a methodology as a systematic review would have, because a systematic review has a very systematic, as the name implies, way that it goes about looking at the literature. Scoping reviews are more, I guess you might want to say, they have less rigor in how they're conducted. The literature review is conducted. Or a narrative review, which is actually what most of our groups are probably doing with our research groups right now, is we're looking at just gathering what evidence we can find, all the evidence that we can find, and creating a narrative review. Or an integrative, I'm probably not saying that right, integrative review, looking at integrating several sources. Similar to a narrative review, but it has a little bit different structure in the way that it's written up. Again, case reports where we're just reporting on a particular case, which is often the case when it's something unique or interesting. Maybe a new kind of prosthesis was developed and only a handful of people have used this prosthesis. Well, the only kind of evidence that we may have at that point in time is a case report describing what that's like. So we don't want to count it out. It's still very interesting and evidence about what might become best practice in the future, but there's just not that base of evidence that's been created for that case report yet. We also have things like quality improvement or program evaluation studies or financial evaluation studies that might tell us like what's the financial efficacy of a certain intervention program. Also very interesting, but just not at that evidence level of a randomized controlled trial to tell us what's the causational impact of an intervention. But it is still evidence. Okay, so that takes us through Appendix D, and then Appendix E takes us to looking at the quality. This is our ABC quality levels, okay? So Appendix E will give us how to give us the quality, the A, B, or C level of experimental, quasi-experimental studies and non-experimental studies. But what if it's more in that 4 or 5 range? Then we need to move on to Appendix F, which tells us how to look at the quality of a scoping and narrative literature review and of expert opinions. And these are the high, good, and low, right? So take a look at those appendices, the D, the E, and the F. Those are going to be the ones that we're using most often. So to sum it all up, and then we have a few that kind of pull it together for us. We are not using these appendices, but just to let you know that they exist, because someday you might be in a study group, a journal club, that you decide you want to do an evidence-based practice project, and you might want to use these tools. Appendix G is the literature table. This is very similar to the literature table that we are using as we sum up the literature that we're collecting. In fact, the tool that I provided for you all that you used earlier in the semester and that hopefully you're still using is somewhat based on the Johns Hopkins tool. So Appendix H then, you've broken it all down, you've torn it all apart. Now we're going to put it back together again. We're going to do this literature synthesis table. What is the literature telling us about implementing this evidence? So we're going to pull the recommendations from the different articles that we've looked at, and we're going to create this synthesis of what are we now knowing about this particular topic, about our PICO question or our PICO question that we're going to want to put into practice. Appendix I then takes those recommendations from the synthesis and translates them into an action plan, and looks at also what is the feasibility, how much is this going to cost versus the benefit, what's the fit for our particular facility or our client population, and what's the acceptability. Will this be an accepted intervention? Appendix J then looks at dissemination. Are we going to publish this? Are we going to present it? And honestly, if you are ever in a practice group that goes to all the effort of pulling this evidence together, I would really recommend you at least do a presentation on the state or national level of what did you find, because that's going to be really useful to other people in practice. Because now you have created your own level 5 evidence. You've provided a summary of the evidence, and other people can use that secondary source as a benefit to them in their practice as well. So I feel like it's important to talk about the research article structure, because as we're critiquing articles, this is one of the things that we consider. It's not just the level of evidence on the pyramid. It's not just the ABC quality level. It's also how well did they look at each part of their article and answer their own research question, because everything that we do should always circle back to that research question. So we need to take a look at that introduction. Did they provide in both their abstract and in their introduction a foundation, an outline of what they're going to be doing in their article methodology? In their literature review, did they provide enough sound evidence that says that this project is needed, that there's a gap in the literature, that there would be a benefit to doing this study? In their methods section, did they provide a clear methodology, including who their participants were that they hoped to gain, how they designed their study, what kind of a study design did they use, what sort of measures did they use to determine whether or not people were meeting the outcomes that they wanted? What were the results, whether it's quantitative and statistical results or qualitative findings? Did they have some sound methodology that provided those results? In their discussion, did they tie what they found back to their introduction and their research question? Did they demonstrate that they answered their research question? And did they demonstrate that they did something similar to or different from the literature that was already out there? And then in their conclusion, did they pull it all together and show how they answered their research question and showed how they used a strong methodology to reach that? So it isn't just did they contain these sections, but how in each of these sections did they provide a strong demonstration that what they did in their research study was a good study. I used the Flinders article. It's a PDF that is available online. as a sort of a quick reference guide as you're critiquing each of these sections of a research article. So I recommend that you look at that. That is provided on Brightspace as well. So this takes us back to thinking about statistical quality or the statistical conclusion validity that we talked about within the last couple of weeks. And remember, these are the three aspects that, according to Cochrane, are the things that a research study has to have. So this actually lines right up with what we look at in the Johns Hopkins tools. Is the evidence strong? This is where our levels come in. Did they have a good effect size, which Johns Hopkins doesn't really talk about? And then was the evidence relevant, which Johns Hopkins does talk about? Was the evidence that they provided relevant to the issue that we were looking at in our literature review? That pretty much sums it up. Critiquing is part of the evidence-based practice process. As you are doing your research literature reviews with your research groups, you need to look at each and every article critically as part of this process. Is this the right article for you to use? And not only the quality, but before you even ask about the quality, is this answering the PICO, PICOT question that your group has? If it doesn't answer the question, then you don't need that article. But then once you decide that it does, then you need to critique it. And then know the quality of evidence for the topic. And then once you've collected all that information, consider how you're disseminating this. Who's going to be your audience for this process? And consider that early in your evidence-based practice review process. That's it. Thanks. We'll see you soon.